Good everybody. Welcome to today's webinar entitled Leading Change in Home Care, Embedding Nursing Order Sets in Procura and a Wound Care App, presented by Sarah Von Schober. Sarah is a clinical manager at Bayshore. Sarah oversees clinical development, deployment, and evaluation that are evidence-based. She is responsible for complex clinical program development methodology, training from paper to electronic, protocols, pathways, policy development, point of care products, tools development, documentation, health information implications, and program development. She provides clinical guidance and leadership to cross-functional teams and ensures implementation of project management methodologies for current fiasco and operation projects. Prior to joining Bayshore, Sarah was the clinical analyst and systems training manager at Mount Sinai Hospital and was informatics operation manager to the clinical analysis and system training team. Please note that this webinar will be recorded and today's participants will receive an email with instructions on how to access the recorded link, which will be saved and posted to the RNAO website and RNAO eHealth Communities of Practice. At the time, all participants are in listening mode and automatically muted for the presentation portion of today's session. There will be an opportunity to ask questions at the end of the presentation. There are two ways to do so. The first is to type your question in the chat box on your screen, and the second option is to unmute your line by pressing *7 and asking the question verbally. We'll also be doing a formal evaluation at the end of the presentation. We kindly ask that you stay until the end of today's presentation and complete the 6 short questions. Thank you, and I'll turn it over to Sarah to begin. Sarah, just a friendly reminder to unmute your line by pressing *7.
I hope everyone can hear me okay.
I hear you, Sarah.
Perfect. Thank you for joining my presentation webinar hosted by RNAO, and thank you, Tanya, for that introduction. I'm going to talk to you about the project I've been working with RNAO for the last, I believe it's been over a year, and it's really around implementing nursing order sets and the opportunity that we had within home care to develop, as Tanya mentioned, a wound care app, which I'd love to share those features with you today. I'm going to the next slide. Give it a bit of a glitch or delay with me being over Citrix, so I'm sorry for any of the technical issues that may happen, and hopefully I'll cross my fingers that there's none. So presentation objectives. Today, as mentioned, just wanted to review best practices for embedding RNAO's ICNP encoded nursing order sets within Procura, and this will support technology-enabled data collection, which I'm going to show you or just talk very high level around the project and the data extraction that we implemented for outcome evaluation. Thanks really to note who sponsored and this project was Canada Health Info for funding this initiative and RNAO for their project sponsorship and definitely ongoing support. As I spoke to, it has been a project nearly a year, as you see there, since January 2016, working with the RNAO, and my role within the project was not only to project lead within Bayshore, but also my role was as a recognized nurse peer leader in the network with Canada Health Infoway, and it's been very valuable working with the other nurse peer leaders as part of this project. RNAO recruited the other NPLs that I've worked with over the past year, and we participated across various healthcare organizations through the request for a proposal process. Well, Bayshore Healthcare is one of 4 organizations that is participating in this project. About Bayshore, if any of you are unfamiliar with us, I'd love to share who we are. Bayshore is a home care, healthcare organization. We do have various divisions under our Bayshore Healthcare organization. We have our home health, which is a big division. We are national all across Canada. We have therapy and rehab, division and specialty RX, which is our pharmacy, and dialysis unit. why that we have around 11,000 staff members across Canada, and we have 60 home care offices across Canada with, as mentioned, 11 pharmacies and 40 community care clinics. Really to talk to around what this project was and my involvement with NAO and what is the project in terms of how we implemented nursing order sets. RNAO have developed many nursing order sets, and this is a knowledge translation tool to embed the clinical best practice guidelines within health information systems or paper-based environments. This provides context for clinical decision support logic, which I'll talk to later in the presentation, which allows us to trigger interventions based on specific parameters and supports our clinicians to get alerts or reminders within the systems, as well as enhance client safety, which is all around the point of care decision making, which most of you have implemented or have gone through with electronic health systems, electronic health records. About specifically Bayshore, we implemented two best practice guides within Procura 8.0. Procura is our primary electronic health record within our home care or care branches, and those two RNAO are there on the screen, which is the assessment and management of foot ulcers for people with diabetes, the strategies to support self-management in chronic conditions. Our order set implementation team, or I would refer to this as the project team, had many layers within the project, and this being shown on the screen, the many layers that were questions that were involved with the project. So we worked with nurses direct since the beginning of the design of the nursing order sets into our Procura system, which is those nurses with clinical informatics experience. We also utilize subject matter experts at the forefront, and this would be the many end users, wound clinicians, diabetes, nurses that have strong expertise in the field to help support implementation and design. We also consulted our physician advisory champion and our nurse champions. Important as part of this project, we worked closely with our clinical informatics team and helped to design and build and implement within Procura, as well as very closely with decision support around the data extraction or the report piece of how we would like to implement the reports and submit data to Enquire. Other interdisciplinary team members, as you see, we've consulted with other clinical practice leaders within our team, and within around the app, we have a quality team, privacy and risk, which we have also consulted with before deployment. Of the RNAO nursing order set, as may be familiar with, is shown on the screen here, where we looked at the assessment and management of foot ulcers with clients with diabetes, and we looked at the component parts and around the nursing process, completed thorough analysis as how do we embed this within our system, implement this into practice. So see here, if I'm able to highlight this assessment area where we looked at our comprehensive assessments and integrated this, as well as through nursing process, we've implemented this, whether it be in our care planning or intervention statements. And then behind the scenes, which I'll show you through further screenshots, include the ICMP codes, which will allow us to extract data. And we're looking to, as part of always nursing practice, evaluate in terms of quality improvement when the data is submitted. I want to show a little bit about how we designed and built and planned within the project previously the nursing order sets, we, as mentioned, work very closely with our clinical informatics team and our subject matter experts, those being the nurse clinicians and clinical practice leaders, specifically with wound and diabetes. Completed a thorough analysis of current state and looked at our system prior and how it was initially with the assessments and whatnot. But we looked at complete analysis by looking at what we had in the system to date and what we needed to redesign or enhance further. So you'll see here across the top, we looked at all our assessments and where it was located, whether it was a standalone form and which form it was, and what that nursing order set would translate to in terms of the actual intervention statement. We also looked at our care planning within the Procura system, which we have specific pathways for diabetes and wound, and aligned with the best practices around whether you see as example, whether at current time we have that in this or whether we had to embed that further or redesign that into our system. So the key component when you complete current state workflow analysis, and then we looked at our, obviously looking at the front end user view of how that would display, whether it's go through the workflow from current state and then the future state rebuild into our system. So this is just an example and screenshot of how our system, our electronic health record, Procura, looks to date. And we included the intervention statement here, as you see, and then specific nursing practices as such. You see ABIP, API completed, and lower limb assessment around the best practices for wound management and specifically with diabetes clients. Then nurse order set, I mentioned the key component of the ICNP codes, and so Procura has the ability to embed this in the back end of our system and aligned with the nursing order set and the best practice guidance implementation. So here's an example of Procura and where we completed that analysis thoroughly and embedded the reference number, as you see here, so that we are able to extract that data on an annual, monthly basis submission to require. I did this screenshot because I think this is, though it was a very rigorous process from the design, analysis, and implementation phase, what we have is the ability to submit the data, as mentioned, ongoingly through the reports to NQuire. And this is an example of a graph that we can pull, and it's around this specific one example is around measurement of clients with offloading and whether they use a pressure relief device. And so this is one of the indicators within the nursing order sets. And so we can, based on the implementation site, see that care delivery and whether we need to, as mentioned here at the very top, I see that this is a very key component of ongoing clinical practice measurement or ongoing clinical program measurement. And it allows us to have the opportunity for quality improvement initiatives, or just that point in time of, looking at how we're caring for clients on a month-to-month basis. And NQuire allows us to do that. And so we're looking at our data almost regularly, and then sure, we're really looking at what can we do to improve care. We all do in terms of nursing care for all our clients, especially across sectors. To include this slide as an important consideration when you're implementing nursing order sets. And this is just a summary slide in terms of, the previous slides that I had went through around the importance of looking at what are the current assessments within your systems, and then how you can enhance that further with the practice guidelines and nursing order sets. This was a big component as we this throughout the first few months of our project, and big piece as I mentioned was the care planning methodology included within the project. The indicators that drove that were really the data dictionaries for RNAO, supported the package with the nursing order sets, but the best practice guidelines, and then each around the DFU, or say diabetic foot ulcer wound management data dictionaries, and the self-management indicators. The team, which was earlier mentioned, we collaborated extensively with decision support nursing informatics, allowing us to build and then with the previous slide, extract data to submit to NQuire from our Procura system to NQuire. So this is part of ongoing evaluation and ongoing measurement as explained. In terms of presentation, I know I went through a few of the very high-level phases of how we implemented the nursing order sets around diabetic wound clients and self-management, but I also have the opportunity to share with you how we implemented the e-functions or the ecologies that we did through this project. And at Bayshore, we had the opportunity to co-design a wound management app around the supporting of self-management for clients with diabetes. So it is, I'm going to show you a few slides, and I hope I have the opportunity to answer any questions. It is an app, and so it's an app that is deployed through an Android device, and it was a pilot within Simcoe, our Barrie branch, within our home care branches, and we to implement within our wound clinic, which is one of the largest wound clinics we have within Bayshore. The patient engagement app was co-designed with a vendor, but we engaged a number of interdisciplinary team members that I earlier mentioned, whether it was our clinician wounds, frontline nurses, as well as our physician advisory council, and that allowed us to design an app in Bayshore to promote self-management to clients that we served with diabetes and wounds. There is a pilot currently in place. We went live November 1st, I believe, and the client we are using the app actively. There's nearly 15 clients right now, but some have been discharged, and we want to increase our pilot with using a number of 20 or more. Around the wound, the self-management promotion, and so therefore there's approximately 10 staff in total, being the wound clinicians or the wound nurses in the clinic, and we are able to look at the utilization of the wound app and how they are promoting self-management. The next slide I'll have is just around our model in promotion of self-management. So we, as nurses, we know a big component of our role is being that health coach or promotion of self-management, as you see. And so this would be the nurse within the Barrie wound clinic. They do liaise with the number of interdisciplinary team members, as you all do in your day-to-day settings, and the relationship that they have with the clients and using the app, this piece of technology allows us to promote patient engagement around wound healing, and we're hoping to see that we're promoting ongoing self-management with technology and improving their quality of life, especially in working with clients in their own homes. So a little bit of the workflow: the client comes to our wound clinic, is given the app or the Android, and they're able to use the app within their own homes, looking at how their wound is healing, what kind of alerts do they need to send to their wound clinic or health coach, and those alerts are around they have the ability to text and send images, wound images of their diabetic foot ulcer, and that automatically goes to a nurse portal. The next slide I show is exactly what I'm speaking of, and this app that I have here, sorry about this little technical. There's two, I'd like to talk to you about, I was speaking about the Android device or app. It has all the components of the best practice guidelines around self-management. So we've developed a self-assessment, which the client is able to fill out within the app. This allows them to, reflect on their readiness for change, goals, and also the symptom monitoring around diabetes. So they track their blood sugars as often as they should, whether it's 3 times a day, 4 times a day, or just before meals, more night. And all that blood sugar tracking does automatically get within the device, but also is with a portal for the nurse to view prior to that arriving in the wound clinic for their visit. And they have the ability to take pictures of their wound, so that way the nurse can also see that the progress of their wound, and really have, just as the project manager, is really a valuable component here, because we can look at that ongoing healing and that progression of the healing and how well they're doing, and the nurse can see those wound images and maybe send a message back to the client saying they should come back to or schedule a client as early as possible, another appointment as early as possible, because maybe they're showing signs and symptoms of infection. I mentioned that they have the ability to communicate with the nurse real time, so that is through the text message feature, and those text messages will be displayed through that portal, through the dashboard, and then there is a bit of what I'll call a hub, where all the messages will be relayed to that wound clinic nurse almost instantly, and they can see the number of messages being sent from all the active clients, and they'll relay back and forth through text or calling the client back. As reminders, appointment trackings, again, that's all there for that design that we did within the app. And on the wound clinic dashboard side, or the portal, as mentioned, I mentioned some of the features in relationship to the app. Additional features is that the nurse can also track her own notes, and when the client does come in bringing in their app, they would also record some of that dialogue or discussion in support of self-management and progress to how they are, managing their own care. Saw this opportunity to develop an app, and then why did we choose an app? It was just a great opportunity through this project to look at enhancing technology more so. So, especially with our clients in their home or in home care, we are not always with the client as we, obvious. And so therefore having a piece of technology in this app that they can bring to their day-to-day own lifestyle or their own home, we're hoping to see that this would be the overall outcome or objectives of the project, that we're helping to support self-management at the higher level, but we want to see that we are helping to promote faster healing time, decreasing risk or complications, as mentioned, signs and symptoms of an infection, decreasing amputations because managing their diabetes and wounds, and overall improving how is the client feeling in that support model of quality of life and health status through the self-management model framework that we've implemented through the technology. I think a vital piece here in allow me to share my experience as a nurse peer leader, but sharing some early adoption of this project and around the app is that we are hoping to see that we are improving the care through implementation of the nursing order sets through the Self-Management Framework, or BPG. And overall, we would like to see that the key objective is that we're improving efficiency of clinical documentation for nurses by implementing, the structured care or the best practices promoted within the nursing order sets and guidelines. The ability to collect data for ongoing measurement is really pivotal for us, because we can extract the data as mentioned and submit to NOS, as well as in-house be able to measure our clinical programs around diabetes and wound management, which we've implemented through this project. Also, I think a big thing that we as healthcare providers look at is how can we enhance patient e-services or patient delivery through innovation. I think this opportunity through this project of development of the wound has allowed us to do that within Bayshore. I think we've also want to ensure that we have at Bayshore always promote the organizational vision for support of self-management is for the clients in the home. I think to share some of the best practices and implementation just from the project level and share with you is that I think it's a critical piece, or that critical success factor was implementing through a project management framework. And I think my peers or the other nurse peer leaders would echo that sentiment, because we all work very closely with one another to apply within our own organization that framework, and it allowed us to meet the timelines as well as with competing priorities, yet deliver the goal or the objectives of the project. I think within the project management framework, a big component part was the stakeholder engagement plan, which I shared with you around identifying early who would be involved in the project and what is that support that you're looking to implement when you roll out any project, but in terms of this and the nursing order sets. So their engagement of, providing their feedback as clinicians of design for the nursing order sets into Procura or any system, our electronic health record. And that's just an example of that, or working with decision support, which is another part of stakeholder. We also, through this project, had an internal steering committee, which was very crucial part for risk mitigation or consult to whether it's, additional engagement of clients or other levels for the implementation of the app. A key thing that I did not highlight is that as part of any project, I would suggest, or we in-house really paid attention to the user acceptance testing, which you may be familiar with. And this was around the redesign of our current assessments, the redesign of the care planning intervention statements of what's built in Procura, and how we are enhancing documentation by implementing the best practice guidelines for diabetes and wound management. So we redesigned our wound documentation through this project. And then also from the UAT perspective, prior to rolling out the app, we did a series of UAT sessions with the physicians or interdisciplinary team members, the frontline nurses, and a few clients, just to gain feedback of changes to work into the app, or it was actually deployed to the rest of the clients that we engaged. This is support, if you have that within your organizations, is very key, and it's been an ongoing, back and forth iteration of, the data, looking at the indicators and where we're pulling the data from within our EHR, and then how are we going to design the reports extracted out of Procura and how that will be then submitted to Enquire. This is all part of that automation of this project and reporting requirements. So this slide is just to highlight a few of the best practices that I would like to share with you around the implementation. And I don't know in terms of timing, Tanya, where I'm at, but I'm really wanted to kind of high level provide this presentation and answer any questions that the group or the attendees may have.
That's a few ways to ask questions. You can unmute your line by pressing *7, or you can type your question in the chat box. About 10 minutes or so, but I think I'm definitely open to questions beyond this presentation. Tanya, I'm not familiar, but with the feature, but that's the chat. Any questions, I'll be able to see them and I can read them out. So okay. So if there's any questions, feel free to ask. Just line by pressing *7. You count to 10. No one to make sure I cut anybody off, but if there are no questions at all, I just want to thank the attendees for joining. This was the evaluation that Tanya was referring to. Yeah, I want to just advance to the next slide, Sarah, and then I can open up the polls for everybody. Oh, okay. With that slide, Tanya? I think it might be the next one. I just see questions on this slide. Yep. So I'm going to take a minute to open up the polls, and then if we can just take some time just to fill in the short questions, that'd be great. And you'll be able to fill them in just on the side of your screen. And there's a list of 6 questions. We'll just participants answer those. Leave my screen like this? Yep, just for now. Results coming in, so just a few more minutes. Great. Maybe just 1 minute in case there was anybody else who wanted to fill the survey.
A quick question?
Yeah, that'd be great.
I'm wondering, when you referred to the technology, so did you, and I wasn't actually able to see the slides, I was just listening, so maybe it was in the slide, I apologize, but did you guys actually give the clients some piece of technology, or did you just install this app on their own for tablet or whatever device?
Mm-hmm. It was a managed device program, so we actually gave the Android device to the clients. So it was, at this point, we're looking at, the opportunity in the future, perhaps they can download it off the, but whatever Android's equivalent. But in this project, it was more so mesh device installed. The app was locally installed through the device. That device we gave them.
And are there any other questions?
Actually, so a question. You were your acceptance testing, which is really great, but how did you figure out what clients to give it to? Because there's some clients that's just not going to work the technology piece. Like, did you have some?
Yes. And there were clients, and to share that, we offered, when we actually deployed or went live with the product, there were clients that weren't interested, to your point, in technology. They were technology adverse. With coaching, that was fine with us. It was up to whether they wanted to be part of the pilot or not, or whether they wanted to use it in terms of we offered as part of our service delivery model. And so prior to your question, just to answer your question, it was a volunteer period. So those more so the clients that have been with us for a few years and know us very well, that come to the wound clinic. We just said we're about to deploy a app, and would you be interested in seeing it and giving us feedback? It's going, and be part of it. So that's how we engaged a couple of the clients that were part of the project now, and then using the app, and then prior we just kind of asked volunteer basis.
How did you fund the devices?
It was supported through Bayshore, so we for budget, and then through some of the funding through the project.
Oh, that's good, because that's an extra piece. Like, even because you even have to pay for the, for data and everything.
Actually, to answer that question, so it's not. There is no. They only have the app, but they don't have the opportunity at this point to access the internet.
Oh, so you were able to limit it.
That's right. So we restrict with the vendor that we work with. We restricted the use of internet, so they couldn't surf YouTube in that sense, and we wouldn't be able to know what they would use. We wanted to strictly measure the use of the app.
Do you have any issues with any of them getting lost or broken or anything like that?
Good question. Yes. And I'll always give you the honest. But I think, unfortunately, we see there was 2 devices, so it's a N factor of 20. So we are managing 20 devices and going through the admission to discharging of clients with diabetes in the wound clinic. And unfortunately, we lost one device because one of the clients did. So we were able to retrieve the device out of his home. The home care setting, right? And then I think another device, we are waiting for the client to return the device because he was discharged, and in terms of our care, we didn't know he was discharged until a week later, and we followed up with him, and he was discharged service. He has to provide the return back.
When will you decide and evaluate if you're going to continue on and make it broader?
Actually, we're looking in terms of, because we all have budgets, right? Organizationally. So looking to do another comparison to roll out and possibly partner with a hospital if anyone's interested. But because we wanted to look from, that whole we want to implement the care transition model, care transition BPG. And so that way we'd like to see whether we can see, from hospital to home and use of the app. And that's just some of the planning of expansion.
Interesting. Thank you.
Thank you. Tanya, do I go on to I'm sure if I close this window, right?
Yeah, you go on to the next slide.
Okay. And I think just promotion of upcoming webinars from my other nurse peer leaders. I believe we have 2 additional upcoming webinars from St. Joe's, right, because Epic. And I think this is us in our cohort, or us coming as nurse peer leaders for the 11th H. Is that right, Tanya? I think
that's correct.
It's our May 11th.
Yep. Information is on the RNAO website, and it's just on your screen. So if you're interested, feel free to register.
And I hope, and just to I'll give that plug on behalf of all of our nurse peer leaders, it is a representation of all the sectors, so long-term care, acute care, I think that is the Meditech and Epic, St. Joe's and Blue Water, and then home care, and then we'll all be there on May 11th.
Thanks, Sarah. If there's no other questions, I thank everybody, and if you do have a question, you can feel free to contact any of the nurse peer leaders, or if you've got a question about the RNAO, ICNP, and coded nursing order sets, you can email Rita Wilson. She's the program manager here at RNAO, and then she'll be more than happy to answer any of your questions. So at this time, I would just like to thank all participants for joining. Again, the recorded link and the PowerPoint slides will be available, and thank you to you, Zara, for this great presentation. So,
thanks for the support, Tanya, and thank you everyone for attending.
Thanks.